Good morning and welcome to, today is going to be four therapists sitting in a tree, Talking. My name is Harla Rudolph. I'm the founder and CEO of the Speech Tree.
And I'm Carolyn Herbin, the owner of Ready, Set, Grow Therapy.
And we are very excited today. We have two very special guests, Sarah Meliani, board certified behavioral analyst, and Kayley Rusakis, Director of Operations for ABA program at the Speech Tree. Welcome, ladies.
Thanks for having us.
How are you doing today?
Good.
You had your coffee already?
Yes.
You ready to go?
Yes.
So we have a lot to talk about, all ABA and everything thereafter. It's beautiful out. Maybe next podcast we could do outside. What do you think, Ethan? Yes? Ethan says yes.
That'd be nice. At the beach?
Yeah, at the beach. So Sarah is, like I said, board certified behavioral analyst. We call it BCBA for short. She's been working at the Speech Tree since 2020. I remember when I found you, I literally was searching on LinkedIn, and what a surprise. I was able to find this gem,
Oh, thank you.
Yes. So you've been working, like I said, for about 4 years now. And Kayley Rusakis, who I feel like I've known forever. I think we're known each other in a different lifetime.
Definitely.
Is our Director of Operations for ABA and has been such since 2019. So you've both been through COVID with us.
Yes.
Right?
That feels like 100 years.
It does. So I just want to start by saying Sarah, if you could talk about your background and how you got into ABA and where you went to school. And
Absolutely.
Go ahead.
All right, awesome. So I am a BCBA. I actually started as a teacher, special education teacher, where I taught students who were preschool disabled. And, in the practice, I was using a lot of ABA strategies. And I'm like, what is this? This is new. It kind of shifted my mindset a bit just because I think a lot of us are just so used to using timeouts and punishment, and it was just a total shift from that. And it was positive reinforcement on a really frequent basis, but then I saw it work, and I was like, I have to get into this. So I went to school, and I got my master's first in special education, and then I went for my ABA certification.
Where'd you go to school?
Monmouth University. And then I went for my ABA certification at Capella. So I completed that whole process, and I was doing my hours both in school and private, which was great because I got to see the best of both worlds. I got to experience what ABA is like in a school setting, and then also what ABA is like in a private setting, and I love both.
When you say do your hours, what does that mean?
So that means that, BCBAs must complete a certain amount of hours in order to qualify to sit for the actual exam. At that time, I want to say it was 2,000 hours, and now I know it's definitely increased. But, we get observed by a BCBA, they come in, they provide feedback for us, and it just provides that hands-on training so that you can be the most effective when you do eventually pass the test. So that's what led me here today, and I currently work in a school district as well as for you guys. And again, I love being with both settings just because you get to do so much and it's so different in a school versus the private.
So maybe you could let us in on I know we all know, but parents listening, what is ABA?
So ABA is applied behavior analysis, and it's based off of, reinforcement procedures. So a lot of it entails, just reinforcing the behaviors that we want to see, and kind of, ignoring the behaviors that you don't want to see. It's about just increasing those pro-social behaviors. We also work on language. We work on life skills. We work on social skills. So it's a whole slew of different practices. I like to think that we incorporate a lot of the OT and a lot of the speech into our practice. And we just want to increase these pro-social behaviors in our learners so that they can live the most successful life.
I love, love, love how you keep saying positive reinforcers.
Yes.
Because I feel like there's so many years now, or I want to say for the past 5 or 6 years, there's been a negative connotation with ABA.
Oh, yes.
So I love that you keep saying positive, positive, because that's what it is. And that's what it should be.
Exactly. Right. And I think the negative comes from, individuals will just think positive reinforcement means edibles, but that's not the case. A lot of the time, and now more so, we do not use edibles in ABA, and edibles are just like food rewards. And sometimes, parents and staff will get freaked out. They're like, my kid is not a dog, because you pair that. Right. But we don't use that anymore. That's something that's practiced maybe 10 years ago, and it's something that now we try to incorporate the child's interest, and just even natural reinforcement of just a high five, praise. Everyone likes to be told that they're doing a good job, so I think that it's super important that we emphasize as natural as possible.
Definitely.
Yeah. So why don't you take us through what a process would look like if Kayley, if a parent calls and says, I have a concern, I'm looking for ABA services.
Definitely.
How does that work?
So typically a child needs to have an autism diagnosis in order for ABA therapy to be a covered benefit through their private health insurance. We are an insurance, we accept insurance as our payer of how we get reimbursed for services. Most health insurance plans include an ABA therapy coverage. A lot of times there's not a limitation on it, but it is very specific to where the plan is being written from, which is usually, the guardian's employer is the one that's creating that plan. So the first thing that we do is we need to obtain that diagnosis report and get a pre-authorization for services. So this is an approval from the insurance company for one of our BCBAs, such as Sarah, to do an initial assessment of the child. Sarah can talk a little bit about what the assessment looks like, but it typically is an in-person assessment as well as some parent questionnaires that the BCB is able to write a report that includes all of the goals that we're going to target during sessions, and they'll also give their clinical recommendation of how many hours a week of ABA therapy we're recommending, and then insurance has to approve that number of recommendations. So there's a lot that goes on behind the scenes before an ABA therapist and a BCBA are actually working with your child and starting treatment.
I just have a question that also for parents might not know. What is the difference between an ABA therapist and a BCBA?
Yeah.
So the BCBA actually is the one that's writing the plan, writing the program, evaluating the student, the client, and developing that program. Then it's the BCBA's role to train the ABA therapist who's going to be implementing that on the day-to-day. The BCBA will come in to consult and to provide feedback to the ABA therapist to make sure that those goals are being met, and that the ABA therapist is implementing each of those programs and targets with fidelity.
So what does an assessment look like? Because that's really the first step, right?
Yes. So we have different assessments, which is great because each assessment is going to showcase different skills. So a lot of the time, for me personally, I like to get information from the parent to see where are the skill deficits, where are where is their child thriving? And then I can determine what assessment I can use. There's different assessments out there. There's VB-MAP, there's PEAK, there's ABLES, there's AFLS, and they all target something different. They do share some similar skills, but again, they're going to focus on the three deficits of autism. So the language, the social, and that behavior component. So typically we'll run the assessment, and then, based off that child's deficits, we'll pick a few goals, typically 10 to 12 goals that we'll work on and target during our session. We also take the parents' input as well, because a lot of the time, parents will come to us when they're struggling with their child at home or they're having behavior issues. Oh, my child won't transition to the bath, or my child's having difficulty transitioning to the store, or being told no. So we also take that into account when we're writing our programs and saying, okay, how can we best address these needs for our parents and for our clients that we're going to be taking on?
Go ahead. What were you going to say, Kayley?
I was going to say, I always say to the parents, too, when I'm talking about what the assessment looks like, and a lot of times they'll have a lot of questions about, the treatment plan, what it looks like. I give the example of it'll be similar to an IEP that your child receives in the school district. Mm-hmm. So it'll give, the targets that they're working on, what that mastery criteria is. But it's a working document. When the BCBAs go and do an assessment, it's usually like an hour and a half that they're working with a client. That's such a small amount of time. It's such a little snapshot of what a child is capable of. So especially in those, early weeks or the first couple months, those goals are going to change a lot. Modifications are going to be added. Maybe some goals will be discontinued because it already is a prerequisite that they had that we didn't see upon assessment. So I do always like to tell parents that the treatment plan and the goals that the BCBA is outlining, that's not what they're going to be working on for the next 6 months. That's what they're immediately going to be working on.
Oh, yeah. And it's always changing. And that's a good reflection that you have a strong BCBA and ABA therapist when you're when you see your child making significant progress and that the goals have to be updated on the regular.
Yeah.
Sometimes we get those calls from families and they're saying, my child has been in ABA for so long. We're working on the same thing.
Right.
It's been months. My first response is, well, certainly that shouldn't be because as the BCBA and staff, they should be making accommodations accordingly.
So if you see that a child's not meeting a goal, what's something that you would do?
So, great question. So I always say it's like the 3-day rule. So after like 3 consecutive sessions, if the child's not grasping the concept, then we need to modify it. So then we need to make some type of modification for that child to meet that goal. So let's just say if the child's having a difficult time identifying apple, how can we modify that so that it meets the needs of that learner? So we may have to teach it errorlessly, which means we basically teach it with like a full prompt. And then we
Explain what that is.
Yes. So typically that would just mean that we're giving the child the answer and we're just having the child respond back to us. And then that also provides that reinforcement piece that is big in, ABA world, so that the child says, hey, I did that right. So let me try again. And then they start to grasp the concept, and then we can make it more elaborate. So then maybe we add a picture of an apple and banana, and then, we ask, where's the apple? And then they identify it. And then they realize, okay, this was what got me that praise. I'm going to do it again.
So it's a different way of teaching kids with autism because a lot of the children that are on the spectrum aren't able to grasp concepts the way, they do in possibly so you see it in the school setting. How is it different in the school setting when you have a student and they're not able to grasp a concept and they're doing ABA? Does that look, I actually don't know. Does that look similar to what would be in private practice?
It does. The significant, what I love about private in comparison to schools is that the child's getting that one-to-one undivided attention, whereas school, students will typically not have a one-to-one. They'll maybe be working in a dyad, which means a group of 2, a group of 3, where they're not getting that undivided attention. What's great about the one-to-ones in our private world is that they're getting that one-to-one attention. They're really working on and honing on their individual skills versus being in a group setting. And again, there's nothing wrong with being in a group, but when you're really focusing on building those skills and building those targets, it's great to learn in a one-to-one.
Well, and I assume too, kids are in school for a lot of the day, but the majority of the time they're with their parents and their family.
Yeah.
So I know, I love private practice because we get to work with the families too, because you can teach them and then you see such a huge progress when there's the carryover too. So I can imagine at home you get to work on skills that are so important to the families.
Oh, absolutely. And that's what's great too, without, from offering both center and in-home, it's great because you can work on those in-home behaviors and skills that you typically wouldn't see in a school. So you can work on brushing teeth. You can work on, again, those big transitions. Like a lot of the time, when we have kids and it's time for a bath, and I hate to give that example, kids pair that with oh no, it's time to go to bed. It's almost time and I don't want to go. So working on, providing parents, strategies to help promote those transitions and decrease those behaviors. And it's amazing. And then it starts to generalize everywhere.
Right. And on top of the home services, do you guys go into the community too?
Yeah, we do. We do. And I think that's just equally as important, just because, again, when you're teaching those individualized skills, it's great one-to-one to start. but then we have to build it because we're not going to be one-to-one forever. In the real world, you're not one-to-one for the rest of your life. So it's really important that we look to generalize those skills. So we look to generalize in the home. We look to generalize, in outings. Like, can they tolerate, now that they've tolerated no one-to-one, now that they've tolerated no in the home, can they tolerate no in like a Target where they want their toys? So that's like the next level. So just working on building those skills.
And I think that's important too, because I've heard a lot of parents say, I don't know if you have too, they've had ABA before where the kid can do something in a certain setting, but then they can't generalize it. Yeah. So I think what you're saying, how to generalize it in different settings, is so important when you're getting ABA, because a lot of these kids do. They learn in a certain way and then can't generalize
or they learn it with a certain person.
Yes.
Exactly.
Good point. That's true.
I think that's where the negative stigma comes in. Agreed. Because parents and adults and, even just, regular people who view ABA, they're just thinking, they only know it here, but they can't do it in XYZ. But that's changing. And, we want, we look at our kids now and our clients and, yes, they're young, but we want them to be successful in life. So we always are keeping that long-term goal in the back of our mind, like how can they be successful in the real world? And that's really the end goal. Right. And I think that's the end goal for us as practitioners and, for, the parents and for the child. They want to meet with success.
I love it. I love your passion. I can feel it across the table. I love it. So you walked us through what an evaluation looks like, and we started to talk about therapy. So take us through the steps in, let's say, in our practice in the speech tree. When the BCBA does the assessment, makes the recommendations, what happens next?
Right. So once the BCBA makes a recommendation and develops that treatment plan, we submit that to the insurance company. That typically takes about 14 business days for insurance to give us an approval. So, I say to parents whenever I speak with them, I'm very transparent about that time frame. Just because they're calling and they're saying, I want my kiddo to get ABA services, you're looking at sometimes 30 to 45 days just from a waiting standpoint with the insurance company in order to have that approval for treatment. It is. And that's not the case with every insurance. There are some insurances that are a little bit faster.
Do all insurances need authorization? Or?
Most of the time.
Oh, wow.
Yeah. And there does need to be an autism diagnosis in order for ABA therapy to be something that's covered at a benefit level.
That's a shame, too.
It is.
Other children that would benefit from it.
Absolutely. And we've, in our practice, have had families that an individual doesn't have an ASD diagnosis yet, or maybe has another diagnosis that ABA therapy is going to really help with that decrease in behavior and increase in skill acquisition. So we do see them as clients, but the financial burden lies on the family.
And that's what's hard, because we want early treatment, right?
Of course.
But some of these kids are so little that getting a diagnosis at that age isn't always appropriate.
Oh, right. Absolutely.
Kind of though.
Definitely. So there's barriers that you definitely meet to, being able to qualify for ABA services that are covered through your insurance that a family is able to afford. So during that waiting time, I and my ABA team, we work with the BCBA in making sure that we're assigning the right ABA therapist for the child.
Say that again. Making sure
that we're assigning the right ABA therapist for the client's needs. So sure, we want to look at schedule, right? What the BCBA is recommending in terms of duration of sessions, frequency of sessions, and what our staff has available. But we want to make sure that the strengths of our staff are going to jive with the deficits that we're looking to increase for our clients. So there's a lot of effort that's put into it.
A lot of pieces to that puzzle.
Yeah, there's a lot. So, and I don't think people really realize how much goes on behind the scenes in having really good quality ABA therapy, and that's something that I think sets us as an agency apart from a lot of other companies, is that we stress the importance of quality over quantity. We're not making families have to do a certain number of hours of ABA therapy. It's about making sure that that's
what's right for each kid.
100%, and every kid's different.
Right.
It's one session's not going to look the same as somebody who's in the room next to you. So that's what's happening during that time. The BCBA will be working on getting all of the materials ready that go with the goals that they're going to be working on during session. BCBAs will meet with the family to review that treatment plan to make sure that the family's in agreement with the treatment plan and the goals that they're outlining. And then once insurance approves it, then we determine a start date. The BCBA and the ABA therapists are always together for that first session so that training is happening. And that's a lot happens during that waiting time. Parents are just waiting. They're just waiting for that phone call, but there's a lot that's happening within the company to make sure that it's a successful first session.
How do you decide where you feel the child should get the services? Because it could be in our center or community, in the home. How do you make that decision?
So really, I would say it goes by parent input. If parents are struggling at home, then it wouldn't make sense to do it at the center, because then we wouldn't see any of those behaviors at the center. So it's really important to take the parents' input into consideration when choosing the right setting.
Definitely.
Typically, I always go with, if there are behaviors at home and they are not able to complete their daily routine, or, the parents feeling totally frustrated with, how things are going within the home, or, they're asking for support, then obviously in home would be the way to go. If we're looking at more of a skill acquisition where we're looking to just increase skills, then I would say center, or, more social opportunities, then I would say center-based, because we have the opportunity to provide those social opportunities for those kids. So it all depends on the need. And again, that assessment will drive the placement of the therapy.
And how do you decide how many hours a child should be getting?
Yeah, so this gets, this gets tricky.
I know a lot of parents always think more is better, but that's not always
not for the little ones, especially. Right.
No. So to be totally candid, something that makes me cringe is, these kids are kids, right? They're little. And a lot of our kids, even starting at 3, they're in school all day. It's a long day. So just, what I always try to think about is us as adults, right? We have a long day of work, and then to do, therapy after school could be a lot.
Bless you.
Thank you.
So, bless you, yeah. So it's really important to, take that into consideration, what their day looks like.
Right.
Because to have a child from 4 to 7 at night,
When
Monday
they're
through Friday, when they're exhausted, what are you getting out of that session?
Behaviors.
Right? Behaviors.
And it's behaviors that are
warranted.
That they should have.
Exactly. Even for me, like 4 to 7 every day, I would be just burnt out.
Yeah.
And what are you truly getting out of that? So again, I know, Kayley, you had expressed like quality over quantity. So it's really important that we choose the quality and number of hours. So where is this child going to really thrive? What's that sweet spot? So we, the BCBA, when she does the he does the evaluation, they'll determine how many hours based off parent input, based off scheduling. If a child's highly involved in different activities, and we may want to keep it at a lower number just so that they're able to get those opportunities. So it really all depends on the child, and that's what makes ABA so great. It's all individualized.
And that's really good, because I've also heard a lot of parents tell me they go to places and they tell them it has to be this many hours.
Yes,
I
a
cringe
lot
at
of companies
that.
do
And
that.
again, they're 5 years old and they want them to have 20 hours a week. And then they're like, when do they get to relax?
Okay, let's talk about the real
Or when
reason
do
here.
the parents
Yeah.
get to relax?
We know what what drives
Yeah.
that, which makes me crazy as a therapist and all of us, right?
Definitely.
When you hear that companies could be taking advantage of parents because it's about their bottom line.
Right. It's a monetary incentive. It's
and
not,
it's-
a clinical effectiveness in any way.
And I just kind of want to circle back with why I even started ABA to begin with. I think I've told you this story. So as a speech pathologist, I never thought about bringing ABA into the practice. But one of the things that I was hearing over and over again, we become very close with the parents and the families.
Yeah.
And families coming into the waiting room and just literally crying to me saying, Harla, we can't go through another ABA therapist or another company.
Right.
So it was just gut-wrenching to hear. And, and like I said, there are families. So we started bringing ABA in, and the key was very slowly, right?
Yeah.
And Kayley, you were there from the beginning, so
Yeah.
you know that we introduced it slowly because especially from a company perspective, more is not always better. Like we have to make sure that everything is appropriate for each child. And I think that that's the difference in where if you're a parent and you're with a company and in your gut you say something's not right here, I'm not comfortable. Just ask questions.
Yeah.
If you're not sure, please ask
Absolutely.
questions. And I'm not saying that our company is the end all be all. Yes, I think it's incredible. But there are other good companies. Just ask those questions to make sure that it's your child that they're thinking about and not that monetary bottom line.
Absolutely. And parents always have the right, and it's actually, we want that to be, we want the parents to be involved. So you always have the right to observe a session and just see what goes on. I think that's really important because first of all, you get an idea of what it looks like. You get the feeling, is this something that's working, or do I need to explore a different company? Is my child really pairing with this environment, or or do I need to explore other options? And then also the other pieces too, sitting in on a session, you can pick up skills that you can implement on the day-to-day. So I think that's highly important. So yeah, like I would say trust your gut for sure, because sometimes I hear 40 hours a week, but your child's in school all day, and it's like, it's impossible.
More than a full-time job.
Yeah.
Well, and a lot of time when a child, because I see this all the time when I'm, submitting referrals to the insurance company so that we can get approval for services, developmental pediatricians will make a recommendation of hours. They'll write 40 hours sometimes on a script or 30 hours on a referral. And then a parent is, right, that's what their expectation is, that we're going to see their child for 40 hours a week. And, and then there's always, a little bit of a back and forth with the BCBA that maybe they're only recommending 15 hours a week to start. And maybe we'll look to increase that once, a kiddo is responding well to the therapy. But I get asked the questions, but a doctor told me that they should get 40. And I very much, trust the clinical judgment of all of our BCBAs, and they're the clinician. So I feel the need to have to explain that a lot to parents.
Thank you for explaining that.
Yeah, that a doctor's
Yeah.
diagnosing, but they're not giving a clinical recommendation of what goals need to be worked on. That's the specialty of the BCBA.
Absolutely.
So if the BCBA is making this recommendation, that's the recommendation that we're making for your child.
Well, and I think as a parent too, we need to think about the parents, because I know as a parent, if I had somebody in my house for 40 hours a week, I would be burnt out just from keeping up with, trying to see what they're doing and stuff too. So I think as parents, they need downtime too, and they need to not be running their kid, to therapy every day for all these hours.
Definitely.
So.
It's like the whole family is involved in it. It's a commitment on everyone's part, on the parents' part. If there's siblings, in the family.
Right, they have activities.
Exactly. It's ABA therapy it's a commitment for everybody. So we want to make sure that what we're recommending is something that is clinically appropriate, as well as something that the family is going to feel that they can hold up their end of the bargain of making sure that they're bringing their child for sessions and showing up and participating in parent training that's being offered to them. All of that is, really, really, really important to the growth that we see in our clients.
I was going to ask about parent training. If you could walk us through what a parent training session might look like.
Yeah. Absolutely. So I like to call it like parent collaboration, right?
I like that.
Yeah. So that, we're collaborating on, ideas and strategies to help support the parents and the child at home, typically, or even just to explain the carryover of skills that we're doing at the center, or how we can support you in, a visit to Target or a visit to ShopRite. So the parent training is really important, because that's where you're going to see that generalization piece. A lot of the times, our kids are at the center, which is great. They're building up all these skills. And then the parent's like, but I don't see it at home, or he's not doing it at home. So that's why we want the parent training. And again, like that could be incorporated in observing a session and providing some strategies to the parent directly. That could be, an in-person session at the home. That could also be like a Zoom or, a Google Meet where we're just talking about, some of the things and troubleshooting. But I think it's important for parents to not feel like, oh my God, I'm doing a bad job, and that like this is because of me, and that's not the case. It's all about collaboration, and how can we meet in the middle to figure out what's feasible in your home life and in your setting that you're going to be able to carry over skills. Because, like, let's be honest, it's very hard sometimes, right? We can't be perfect 24/7. You can't be on all the time. And, you know, with work schedules and just life and having multiple kids, like, it is okay that you reinforce Johnny for, you know, and, you know, you incidentally reinforce him for having a bad behavior, or you allow him to do X, Y, and Z, even though he's not supposed to. It's okay. Like,
you know why? We're human.
Yeah, we're
human.
And we're moms. We're just trying to survive some days.
Exactly.
You know?
So I think it's important to collaborate, because with ABA, there's so many different strategies. So we have to figure out what is the best strategy to pick that's going to work best within your home environment. So that's why I like to collaborate with the parents. Because obviously sometimes, you know, when it comes to behaviors, if it's attention seeking, it's so easy for me to say, well, just ignore it. But guess what? That could be really hard in the home environment. You can't just ignore when, you know, Johnny's pulling at your dog and he's about to bite him. So it's really important that we discuss and we troubleshoot different ideas that are going to get the buy-in of the parent. So I think parent training is super, super important, especially if you want to see the carryover of skills. I know that, you know, my son goes to speech at the Speech Tree, and I have to say, you know, if I wasn't a part of those sessions, I wouldn't be able to carry over and see the progress that my son is making. So being a part of that makes all the difference in the world, because if, you know, they're sitting in the session for an hour, but they're not carrying it over at home, and you don't know how to carry it over at home, then that's a big problem. So we need to always make that a part of the programming.
Do you usually include siblings in the sessions as well?
Yeah, of course, especially if the issues are involving the sibling. You know, if, like, parents are concerned that, you know, they're not playing appropriately together, then absolutely, that is the best way to work on those behaviors. So siblings are definitely always included into the sessions and invited. Absolutely.
So some of the behaviors, as we know, could come from a difficulty communicating, or maybe some underlying sensory issues. So if a child can't communicate, they could have self-injurious behaviors, or any type of elopement, any type of behavior. And same thing for a child that's seeking that sensory input, and it comes and it looks like a behavior but we know that the underlying reason may be something else. So how do you handle that?
So I would say that, you know, it is so important to have co-treatment and to have that communication with multiple disciplines of, you know, this child's life, and, you know, the practitioners that are in that child's life. I think it's super, super important to have that open dialogue with the child's different therapists, because with ABA and with behavior and with communication and with the sensory, they're all intertwined, right? So it's not just, sensory's in this box and that's just OT. Speech is over here. No, they're all connected. And with ABA, you're getting everything wrapped in one. But it's important to have that collaboration piece, because I can deem something and I can say, hey, this is a sensory seeking behavior. Let's talk to your OT and let's figure out the best type of sensory input we can provide your kid, so that they don't escalate and seek it inappropriately. Or even the communication piece. You know, Johnny's just crying to get what he wants and he's not using his words. Well, let's troubleshoot. Let's talk to his speech therapist and figure out what's going on. What are they doing within their sessions, so that we can carry it over in our sessions and also within your home. So it's really important that we all work together when working with the clients, because that is going to get you the best outcomes.
Oh, yeah. Because I know in an OT session, probably speech as well, you know, sometimes you'll have a child and they're having behaviors throughout their session, and you can't get your goals done because,
absolutely,
you know,
and it's
so we've had ABA therapists come into our sessions and work with us and show us how they're handling the behavior, so that we can better work with the children as well.
And then everyone needs to be on the same page. So if the ABA therapist is doing one thing and the school is doing another thing, and OT, and so everyone needs to be on the same page, which is so important too.
And especially with the communication piece, right? Like, if we're using a different modality of communication, but speech is using, let's just say, like, trialing an AAC or, you know, a PEC
augmentative device.
Yes. Like, then how is this child going to learn to communicate?
Right.
So it's really important.
They're just going to end up frustrated.
Yeah, exactly.
And they're just going to have a behavior because if communication is an easier form of communicating is to be physical. So that's why we see a lot of that increase in that physical behavior because that's the easiest form of communicating. Communication should be easy, right?
That's I think, so important. I think there's always a reason for a behavior.
A
kid just doesn't act out.
Absolutely.
Right.
Absolutely. And I think that is the biggest mind shift that we have to have with especially the parents, because they just see these behaviors and they think my kid is bad, but that's not the case. Your kid isn't bad. Your child has skill deficits, and we have to work on teaching those appropriate skills so that they learn what to do instead.
Right.
Because most of the time it's a behavior because they're not able to get their needs met, they're not able to communicate. A lot of the time it's because they are unable to transition, so we have to teach them how to transition appropriately. Or there's a sensory piece. They're unable to express that, hey, like, it's too loud. And then figuring out, like, what can we provide, our client when we know that he or she's going in a loud setting? Maybe noise-canceling headphones. So it all depends on the situation, and I think it's important to have that open collaboration, for sure.
So one of the things that we've been talking about through all the podcasts is early identification, early assessment, getting help in as soon as possible, because we know that the end results, you'll obviously progress more, and wait and see doesn't work for our kids.
Right.
Typically what would happen is that you'll see an increase in behaviors for all those reasons. So would you say it's too early ever to start? So sometimes I hear, I'm going to wait, right? I'm going to see if it gets better, or I'm going to just send them to school. What do you say to a parent that might say that?
So I would say that it's never too early to start, because each of the sessions are going to be tailored to that child's level and the child's needs. What happens is if you wait and see is that, like us as adults, we get stuck in these bad habits, and then it becomes really hard to break those bad habits.
Them. Yeah.
So like if, your child is just screaming to get what he or she wants, but has been doing that for 5 years, guess what? It's going to take a really long time to reteach the appropriate way to gain access to that item and use communication. So I would say the earlier the better.
Definitely.
Agreed.
And it teaches that readiness too, which I don't think is bad at all. Like, it's good to learn, the readiness skills, and that will help prepare the child for school-based learning as well as just life, just the waiting and attending. It's super important.
Another thing that's been coming up with ABA and the ABA community, and I think this is actually not just a New Jersey issue, it is a nationwide issue, is the shortage of ABA therapists and BCBAs. So we're hearing stories from parents about these huge wait lists, and we know all about it because
we have them ourselves.
We have them ourselves. And a question I always get, why? So, Kayley, if you could take us through the process of finding an ABA therapist, what you look for, and same thing for BCBAs.
So, especially living in the state of New Jersey, people, a lot of times people talk about how, there's so many individuals with autism in New Jersey. What's up with New Jersey? Well, people are moving here because we have great services. We have good in-school services. We have a lot of ABA companies that are really fantastic. So people move here from other states looking for services. That being said, there are not enough qualified, good practitioners to provide, what I think is quality ABA therapy. ABA therapist, something that I look for. I also want to say an ABA therapist doesn't go to school to be an ABA therapist, okay? A BCBA goes and gets their master's and sits for an exam and, is required to participate in thousands of direct and indirect supervision hours. Whereas an ABA therapist, really anybody could be an ABA therapist if they, in my opinion, if they have the desire to want to learn and they have the desire to want to work with children with disabilities. So I'm not always looking for an ABA therapist that has the most experience working for all these other companies. I'm looking for somebody who really has a passion in the field. A lot of us that work in the field have some type of personal tie to somebody with autism or somebody with a disability. I think that speaks volumes in terms of your empathy and your understanding of who you're working with. a lot of our ABA therapists are paraprofessionals in school districts that work in these ABA classrooms or special education classrooms that maybe aren't doing ABA therapy the entire time during their school day, but they have an understanding of what the principle is of ABA therapy. I think we have great ABA therapists.
I agree.
I hire them, so I think they're pretty great. But you know, I do look for specific things. I'm not looking for a body. I'm not looking for somebody who's going to have the availability just to see a client. I'm looking for somebody who's going to be a great therapist. I work a lot with the BCBAs and training them of how we want our ABA therapists to be.
That was my next question.
Yeah.
So we may have listeners who are interested in being ABA therapists.
Yeah.
Tell me a little bit about what the training looks like.
Right. So we offer a training for new ABA therapists that work with one of our BCBAs, who's actually our clinical supervisor, as well as our ABA program manager. And they go through like the basic ABCs of ABA therapy. What is autism? What are you looking for? How is data being collected? What are some functions of behaviors that you could see during your session? What does a maladaptive behavior look like? What does a self-injurious behavior look like? So we're really training them about ABA therapy. Included in that is a hands-on modeling session that they will be able to observe a senior ABA therapist that's working with a client of ours, so that they're able to see what a session looks like. A lot of ABA therapists, we get that asked a lot. Well, what does a session look like? Well, a session looks different for every kid, but a session should look fun for every kid, right?
Say that again.
A session should look fun for every kid. You shouldn't walk into a room and not and not see an ABA therapist with a smile on their face, using intonations in their voice and reinforcing themselves. An ABA therapist should be a reinforcement. You shouldn't have to give them an edible, or you shouldn't have to give them something tangible because they've done something. Working for that therapist should be reinforcement enough. So we talk a lot about that. Also, something that we do, the first session that an ABA therapist is working with their client, the BCBA is always present. I never have an ABA therapist see a client for their first session without that BCBA there, because they do need that support from their clinician, from their supervisor, to show them that hands-on modeling, take them through some programming, talk with them a little bit about the pairing process. All of that's really important. So I want to make sure that our ABA therapists feel very supported going into their first session.
And that's good, because then they probably stay longer when they feel supported.
Definitely.
That's another thing I've heard a lot of parents say, that a lot of agencies, the turnover is high.
Yeah.
Sometimes you can't avoid that because it is the nature of the industry where they're...
But I think having them supported and trained
helps.
Yes.
Absolutely. Feel like they want to be there.
Definitely. And making them know who they should reach out to when they have questions. Center-based services, they're with other colleagues and other kids, whereas in-home services, sometimes, therapists can feel like they're on an island. There isn't another, colleague that's with them in the home. It's them and the parents and the siblings. So we work really hard on what does that home session look like? What are some barriers to home sessions you might run into as an ABA therapist, and, providing them with some troubleshooting ways that they're able to work through some of that.
Great.
How much BCBA supervision is there?
So insurance and the BACB say like 10 to 20%.
What's the BACB?
The BACB is the board that oversees all of the board-certified behavior analysts. Okay. So that's who they take their exam with. But I expect all of our BCBAs to do 10 to 20% of in-person supervision for direct services. So an easy way that I always explain to parents is if a kiddo's getting 10 hours a week of ABA therapy, you can anticipate your supervising BCBA being with the ABA therapist during session for an hour to 2 hours a week, right? That's 10 to 20% of that direct service. All of our BCBAs do in-person direct service. We don't do teletherapy. We don't have BCBAs that live in Washington that Zoom in.
Oh, Jesus.
I've
heard those stories.
Well, yeah, and
it does happen.
COVID really kicked, made the insurance world accept, a completely different
model.
a different model of billing services. Anything can be virtually now. I don't think ABA therapy is the most productive being virtual.
I think anything virtual can be difficult.
So the BCBAs will be there, like I said, that 10 to 20% of time, providing hands-on modeling, extra work materials. The child should feel just as comfortable with the BCBA as they do their ABA therapist.
Agreed.
There shouldn't be a behavior that's occurring because the BCBA is present because there's an additional person because the kiddo doesn't know who that person is, right? That to me means that like our BCBAs haven't done enough. They haven't done enough. They haven't been present enough. So that's something that I, stress a lot, with our team that, that's what our expectation is.
I love it. I love it. Yeah. Another thing that I hear from parents or a concern is that if I put my child in ABA, it's for life, right? It's forever and ever and ever. But I've actually seen over the past few years, a lot of our kids have been discharged from ABA. Which
graduation is such a happy day.
I love graduation.
Yes.
Love
it's the best.
So walk us through why or how we go through that process of discharging a child from ABA.
Absolutely. So basically there comes a time, and that's a good time, right? Parents shouldn't be upset that, the child has mastered the goals that are developmentally appropriate for that child's age, right? Because we're not going to work on goals that surpass that child's age. That wouldn't make sense because that's not a deficit. They haven't learned that skill yet, and it's not appropriate. So anything that is developmentally appropriate that they have mastered, then it's time to go. So, obviously it's a discussion with the parents, to explain that, hey, they've mastered X, Y, and Z. At this point, your child is where he or she needs to be, and ABA services no longer benefit your child. However, I never want to leave a parent stranded, right? Like, parent will be like, oh my God, what do I do next? There are other ways to go, right? So your child can always grow in the right direction by providing, different types of activities. So let's just say that, this child has mastered these social skills in our smaller setting. Time to take him out of the smaller setting, and maybe you enroll that child for a soccer group or baseball, where they can really practice these skills. So it's never just like a bye-bye, you're gone, but it's us, recommending other avenues that the parents can turn to, because ABA is just no longer benefiting, and we're not going to just work on goals just to provide the service, and to work on mastered goals over and over again, it doesn't make sense. And then it becomes a non-preferred for that child. Right?
I think you're saying that and saying it this way because this has happened before, where we're so excited to tell parents that the child is graduated, and parents get very anxious about that, right? Because they see how beautifully they're doing, and then what's going to happen if I take away that ABA.
Right.
So I think that's why you're saying
exactly. But it's always a good thing. But really, a discharge just means that your child has mastered all the goals. And again, as Kayley had stated, we always update the goals contingent on their mastery. But again, there comes a point in time where they've mastered those developmentally appropriate goals, and it's time to spread your wings and fly.
Yes.
So I think that's really important. That should be something to be celebrated. And there's tons of social skills groups out there that can support your child, but it's just something that should absolutely be celebrated. And there's tons of activities. There's tons of resources out there. So I think it's just such a great thing. And again, I hate to shift it like as a negative, but it should
positive.
be it is positive, and it should be something that's so celebrated. Because you don't want your child in ABA forever. It's not promoting them to be independent. And it's just teaching them to be dependent on that one adult, and that's not going to lead your child to success in the long run.
Definitely.
I love it. We all celebrate that.
Yeah.
So I just want to thank you both for being here.
Of course.
Thanks for having us.
I can't thank you enough for all the incredible work that you guys do on a daily basis. Kayley, behind the scenes, what families. I know it's a lot, so I appreciate it. And Sarah, like you're hands-on. You're both really, really incredible humans.
Thank you.
Thank you.
You are too.
Thanks.
Yes, thanks for having us.
So with that being said, I think we're done today. Carolyn, you have any more questions?
No, I think you guys answered it all.
Okay.
All right.
So everyone have a wonderful day, and we'll see you on the next Two Therapists Sitting in a Tree, TALKING.
Bye.